I want to let you know that that cruciating pain, that severe pain you notice during your menstrual cycle may not be normal. That could be endometriosis, and they don't talk much about it. We are meant to believe that having severe pain during menstruation is normal, but I can put it to you that it is not normal. When that pain has entered to another level of being severe, being so excruciating, then you need to seek for medical attention. Hello everyone, welcome to Giselle. Today we are uncovering the truth about endometriosis, what causes endometriosis, the symptoms, the myths surrounding endometriosis. So if maybe you fall into this category I'm going to mention, I want you to pay attention to this video. Firstly, we need to understand what exactly is endometriosis. Now, normally every month, the inner lining of your uterus called the endometrium builds up and sheds during your period. But in endometriosis, tissue that acts like the lining of your womb, that's the lining of your uterus, start to grow outside your uterus. We are talking about places like your ovaries, your fallopian tube, the outer surface of your uterus, even places like your bladder. Surprising, right? The lining of your uterus can grow in that area, even your intestine in some cases. Now, these tissues that grows outside your uterus still behave as your normal uterine lining. It thickens, it breaks down and bleeds during your cycle. But because it's outside the uterus, the blood has nowhere to go, so it gets trapped. That can lead to inflammation, swelling, scar tissues, and a lot of pain. And this is not normal pain. A lot of women are told they just cramp, take painkillers. But endometriosis pain is quite different. It can feel as if it's a sharp, as if someone is stabbing you in your lower abdomen. You might feel severe cramps that stops you from functioning, or even pains that radiate at your lower back, even your leg. Some persons even feel pain during sex, while for others they can feel it after sex. For some, they feel pain during urination while they are urinating, while some others they feel cruciating pain when they want to pass physics. So when someone tells you you should just take painkillers when you notice severe cramps that stops you from functioning, that you can barely stand or even sleep, you can't even sleep. Some persons, when they're on their period, they can't sit, they can't sleep, they can't do anything. Please don't listen to that person. Painkillers cannot solve this issue. You need to seek for medical attention. Endometriosis is not all about pain. You might notice heavy bleeding, like anytime your period comes out, the bleeding is much, or maybe you spot between periods. You might even notice bloating. Sometimes they call it endobelly. You might notice fatigue, extreme fatigue. So we might notice extreme fatigue. All these are symptoms, signs of endometriosis. Now, here is something surprising about endometriosis. Some persons might have severe endometriosis and might experience mild pain, little pain, while for others, they might have mild disease and experience severe pain. So pain level does not always match how serious this endometriosis is. Now you may be wondering, what exactly causes this endometriosis? Why does it happen? The exact cause of endometriosis is unknown, but it's likely a combination of hormonal factors, immune factors, and genetics can cause this endometriosis. And one of the common theories that can result to endometriosis is retrograde menstruation. Now listen up, for those of you that don't understand what retrograde menstruation actually is. Retrograde menstruation happens when the menstrual blood flows back up. Instead of flowing out of the body, it flows backward into the pelvic cavities. It flows back up through the fallopian tube into the pelvis rather than exiting the body, and this can cause issues. Now, how does immune dysfunction contribute to endometriosis? Listen up. When the body's immune system fails to detect and destroy endometrial tissues, that's the uterus, all these endometrial tissues that grows outside the womb, potentially related to higher rates of inflammation, this can cause endometriosis. So for genetics, if your mother or sister has it, your chances may be higher. And one thing about this endometriosis is that it's often missed or even diagnosed late. This is because period pains are often normalized. This is why I keep on saying this, that if you have excruciating pain during your period, severe pains that stops you from functioning, that stops you from sleeping, that stops you from doing anything. It is not normal. We have normalized this pain that people fails to get their diagnosis right, fails to get this diagnosis early and start treatment early. This is one of the reasons why endometriosis is either misdiagnosed or diagnosed late, and sometimes symptoms is even mistaken for other condition. And one thing about this endometriosis is that it doesn't always show clearly on scan. The only definite way to diagnose it is through a procedure called laparoscopy, a minor surgery where a camera is inserted to look inside the pelvic. Let's talk about fertility. Can endometriosis affect fertility? Well, the answer is yes. Endometriosis can affect fertility. Now listen up. Endometriosis can block your fallopian tube. It can damage your eggs. It can affect ovulation. It can create an unhealthy environment for implantation. But here is the important part. Having endometriosis does not automatically mean that you won't get pregnant. So women get pregnant with endometriosis. Many women with it still conceive naturally or even with medical help. So I know some persons may be curious, is there a cure for endometriosis? This is actually, will I say, it's kind of painful because there is no cure for endometriosis. There is no permanent cure yet for endometriosis, but this condition can be managed. So women end up conceiving naturally or with medical help with endometriosis. It is treatable. Treatment depends on your symptoms and goals. Like if you want to get pregnant, doctors may recommend pain relief medication like NSAIDs to reduce inflammation, hormonal treatment, birth control pills, progesterone therapy. All this helps to slow down the growth of the tissues. Now I'll be answering some myth questions surrounding this endometriosis. And number one myth says, does pregnancy cures endometriosis? Pregnancy is not a cure for endometriosis. Although during pregnancy, your body produces high level of progesterone and you stop seeing your period, this can help to reduce inflammation, slows down the growth of endometrial tissues, temporarily ease symptoms like pains. But here is a catch. After delivery, your hormones return back to normal and your menstrual cycle comes back. So basically, pregnancy is more like a temporary pause, not a solution, not a cure. Now for number two myth, it says, does hysterectomy cures endometriosis completely? That's the removal of the uterus, your womb. Does it cure endometriosis completely? Listen up. Removal of your womb is not a guaranteed cure for endometriosis. This is because the endometriosis, these endometrial lining tissues can grow outside your womb, can exist outside your womb, such as can exist in your ovaries, your fallopian tubes, sometimes your bladder, even your intestine in some cases. So even if the uterus is removed, the remaining endometrial implants can still grow. It can still grow back. These tissues can still grow back. Even if you remove your womb, it can still grow back. This is where it is more dangerous. Hysterectomy may help people with severe symptoms, but take note that it is not 100% effective. That is not the 100% cure for endometriosis. For number three myth, it says, does endometriosis all about infertility? Now listen up. The truth is that endometriosis is much more than infertility issues. Yes, it can affect getting pregnant, but many people with endometriosis still conceive naturally, some with medical help. The bigger picture here is that it can cause severe pelvic pains. Endometriosis can cause severe pains during sex or after sex, chronic fatigue. Let's not talk about the chronic fatigue, or even digestive issues such as bloating. This condition can cause constipation, mental health struggles such as anxiety, depression. So you see, it is a whole body condition, not just a baby making problem, not just a fertility issues. Endometriosis, it is a whole body condition. Now listen up, let's be real for a second. Endometriosis is something many women suffer quietly. Some are told that they are overreacting, while for others they give them painkillers and send them home. While for others, they don't even know what is wrong with them. Some of them get misdiagnosed or even they are diagnosed late. But your vein is very, very valid. If something doesn't feel right, keep asking questions, keep pushing for answers, and don't let anyone dismiss what you are feeling. If a doctor does not hear you, go to another doctor, explain to them that you are having severe cramps. They should listen to it. Let's not normalize it. It is not normal. Now, if you find my video helpful, don't forget to like, subscribe, and share. Bye.